Today we discussed the preparedness and response to infectious diseases outbreaks. So how we can improve surveillance and response to outbreaks like Ebola, Zika, or simply measles outbreak. And what this meeting brought us was that we realized that we invested a lot so far. And when I say we, I mean the European Commission, the member states, working together with scientists and policymakers. And we discussed how we can improve surveillance, how we can conduct clinical research in a very effective way, how we can make sure that the vaccines and the therapies that we need are developed in time. And then, Isabel, you focused a lot on what we can do to improve vaccination coverage, and help people protect themselves against infectious threats. And one of the things that the meeting brought out is not only that we have done a lot so far, but that we should work together. And when I mean working together, it's the scientists, the policymakers. There are a lot of networks that have been established, very effective ones. People that try to connect the labs together. The European Centre for Disease Control is helping improve the surveillance. We have marvelous opportunities because of the digitalization, the ICT. But if we would do things more together, partner, play to each other comparative advantages, we would go much further. Also, and this was one of the positive elements of this meeting, was that we agreed on some of the gaps. We need to share data much better, much quicker. We need to address social sciences, but we need also to capitalize on what has been done in other sectors. There's a lot of insights we can gain on looking how the police forces are working, how governance issues are addressed in other sectors. And this is one of the nice things that was discussed today. We can do more together, we agree on gaps, and we need to find a way forward.
One of the challenges that was made clear today is that infectious diseases are not a problem of the past, but a problem of the present. So they haven't disappeared, and even because we move much more than in the past, one thing that appeared in a country, next day is already in another country. So this is why we need to work more together. We need to pool all the resources and work in a coordinated way, sharing the data, as Barbara said, sharing the resources, sharing the financing, and finding methods of better tackle the infectious diseases. One of the solutions that we have had for a long time, since more than 100 years, are the vaccination. Something that didn't exist before, vaccines, and now that we have the vaccines, sometimes we don't use them because the citizens are hesitant, and sometimes because they are complacent. So they don't see the role of infectious diseases, they don't see that there is a threat, and they don't use the vaccines that are available. So we need not only to invest in the hard science, as we understand that, working with infectious diseases, but also in social science, to understand how people react, how they trust or mistrust the policies that are established usually by the governments, and how to work with the industry that is not necessarily the enemy. So all the different stakeholders, the industry, the researchers, the policymakers, and the citizens, the organizations that are representing them, we have to work together to increase this trust in science and to work better to tackle this problem of infectious diseases.
So this was just the start of a conversation, and we hope to continue it, meet again at regular intervals to see what we've achieved so far together and see what we can do more and better next time.